Hey guys, what's up? This is Dr. Kyle Loveless. I got my spine here with me today. We're gonna talk carpal tunnel syndrome. We're gonna talk nervous system. And one of the things about carpal tunnel that most people don't know is that it doesn't always come from right here. That tingling numbness in the fingertips, the pain in the wrist, not always coming from right here. I'm gonna teach you where it comes from today. 95% of the time, according to the the Journal of Neurology. All right, 2003, this study came out. I've been saying this forever. Unfortunately, that doesn't always translate to most clinical practices. Stay tuned. Hey, make sure you like this channel, subscribe to our channel as well so you constantly are getting the updated videos and everything else that we do. And if you like this, put comments below. Let us know you like it and let us know if there's other things you want to hear about, because we're always looking for new topics to talk to you about in your health. All right, guys, let's talk carpal tunnel. All right, carpal tunnel syndrome comes from this idea that you have the fact that you have a carpal tunnel. There's a tunnel that your nerves go through in your wrist right here. We'll have a picture pop up there so you can see all that, what that looks like on the neurology of it. But you have lots of nerves going to your fingertips, right? And you've experienced this before. Maybe if you've hit your funny bone right here, you've hit what's called the ulnar nerve. It goes through the opposite side right here, and it goes to these fingertips, okay? Your pinky, your ring finger, and then half of your middle finger, and you hit that and it's like that tingling into your fingertips. Well, that's the same thing that's happening, but it's happening in the carpal, the radial nerve that comes through this carpal tunnel, okay? And carpal, these are your carpal bones, so they call it the tunnel, which the radial nerve goes through, and it supports these fingers. So you're gonna get this numbness tingling in the fingertips. If it's coming into these fingertips over here, that's gonna be what they call the tunnel of Guyon. Cool name, right? Don't need to know any of that. All you need to know is that if it's the whole hand, it's more than just carpal tunnel, radial nerve. If it's just this, that's gonna be your carpal tunnel syndrome. And so there's great things that they've shown over the years that you can go and you can break up some scar tissue in there. You can wear a wristband at night, and all those things are great. It takes stress off of that nerve and it keeps it from stretching all night long. But here's the thing, this is what I found in practice, and then I'm gonna tell you what they actually say in the studies. In practice, I found that the majority of the time that somebody comes in with carpal tunnel syndrome, this isn't the problem. Sometimes it is a little bit of the problem, but the majority of the time it's coming from right here. Okay, this is the head, this is the lower neck, and these nerves coming out right here, because that median nerve, the radial nerve, that all comes right through here. Okay, that comes through the arm and goes all the way down to the hands. All these nerves, you have a big bundle of nerves, and we'll have a picture pop up here, but all this bundle of nerves that comes down your arm. And the stress typically comes from here, because here's the deal. We're meant to use our hands. They always say, oh, you're on a computer too much using your hands. No, we're meant to use our hands. We're not meant to be like this all day long, right? All the way to my head, look where it's going. It's all going right there. And it creates stress. That's where our neck pain comes from. That's where our reverse necks come from. We're also on a text messaging world where we're always like this with our head down, and not just text messaging, just looking at the phone, heads down all the time. We're putting tons of stress into this lower spine. And you can see that's just a small little hole. I don't know if you can see that there, but a small little hole that your nerve comes out of. And so that what they've shown in the studies, or what I found in practice, is that when patients come in, they've been to doctors, maybe even had carpal tunnel surgery. I actually had one patient that was told that it wasn't a nerve problem, she had numbness tingling in her hands, and that it was a blood supply problem. And they were actually going to do a whole surgery where they're going to put a stent in her subclavian artery, which supplied the beginning supply of blood to the arm. And that was going to be the answer for her numbness and tingling in her hands. And I looked at her and I said, you know what, give me 1 month. Let's take x-rays first. And I saw her x-rays and like, this clearly could be coming from your neck. I'm not saying it is for sure, but it very well looks like it is. I said, give me 1 month, and if it doesn't go away, continue with the surgery. Within 2 weeks, it was completely gone. And all we did was chiropractic care and worked on correcting the curve in her neck. That's it. Traction, adjustments, that's it. No medication, or no supplements, no pain meds, no diet changes, just boom, chiropractic care. The best thing for chiropractic care is carpal tunnel syndrome is chiropractic care. And so over and over again, I've had patients that told they had to have surgery on their wrists within weeks, within a month, literally. This will go away. And we also adjust the wrists. We also want to make sure that the wrist is moving too. You can adjust those joints. So if you have carpal tunnel syndrome, find a spinal corrective chiropractor in your area that will adjust your wrist, but will also adjust your neck. And I'm talking about adjust your neck. I'm not talking about just like flicking it or massaging it. I'm talking about literally getting the joints moving so that you can get movement into the spine. The movement in the spine is what stops the irritation to the nerve. And here's what the study showed. I lost it on my phone, but I'll pull it back up just so I can read it verbatim. It says 90% of all, this is from the Journal of Neurology in 2003, 90% of all carpal tunnel patients were found to have nerve root irritation in their cervical spine, a condition known as double crush phenomena. And so what I found is that 90%, I think I said 95%, so 90%, I was a little off, but majority of the time, it's coming from the neck. There's irritation in the neck, so it doesn't matter if we just work with this unless you get to this. So I like to do both. I like to get the joints moving in the neck, I like to get the joints moving in the hand, and over time, that will change. And sometimes there is scar tissue that's built up in here, and then you gotta work on getting the scar tissue out. You work on breaking it up. There's certain techniques from that. There's things like the K laser. It's a laser that goes in and breaks up scar tissue. I like saying laser. It's like the Austin Powers, the laser. Anyways, so breaks up that scar tissue in there and can help with that, but it's more than just the scar tissue. Please don't do surgery. Surgery creates scar tissue over time. It might help in the short term. Typically, it's not gonna help in the long term, and that's just it. Unless you have to have surgery, let's not cut our body. Our body is made a certain way. We wanna keep it that way, and the more you cut it, the less it becomes, the less it functions the way it's supposed to, right? So that's it, guys. Chiropractic care, typically this neck or this carpal tunnel issue comes from the lower part of the neck on the nerves that come down to your arms. And the right adjustments, the right techniques in terms of exercises for like spinal traction, different weighting systems we do to help get the curve back in the neck, something called a Denny roll that we have you lay on at home, and home exercises to strengthen the neck so it stays there. That's the protocol you want to follow, along with getting away from this. Okay, being on a computer like this, getting yourself up into a better posture. Oh, and the final one I forgot about that causes it is sleeping on your stomach. So not just being in this position. So some of people they're here all day and then they sleep like this all night. So look, it's twisting my neck all night long, and that's going to irritate those same nerves. So no more sleeping on your stomach. Correct your ergonomics so that your posture gets better. Go to a spinal corrective chiropractor that's going to adjust your neck and your wrist, and take x-rays. You need to see what's actually happening in your neck. And someone that's going to teach you exercises that you can do in their office and at home that's going to make this last, so it's not a constant back and forth process. If you want that and you live in the Charlotte area, come to us. We'd love to help you. We're at Queen City Health Center. Just go to queencityhealthcenter.com. You literally go on our thing. You can pick a time to come in, and we do a complimentary first visit. A complimentary consult and exam. And then if we do any x-rays, there's cost for that, and we tell you what that is. But ultimately, it's a great opportunity to kind of get to know you visit, see if we can help you. Okay, so if that's for you, give us a call. If you live in a different state and coming to Charlotte, North Carolina isn't optimal to you, that's fine. Send us an email. We'll find you somebody in your area. I got lots of friends in America and actually in other countries that we can try to get you connected with someone that will help you, because the last thing you want to do is go cutting on your wrist. Or even worse, just trying to do all different things to the wrist. You're doing all this natural stuff, but it's just not getting rid of it. And that's frustrating too, because that's costly, and that's time, and it costs you time. It affects your job, it affects your work, all those things. So, all right, guys, I hope you got a lot out of this. Hey, like our channel, and make sure you subscribe, and share this with your friends. I know there's plenty of people out there that have arm, wrist, just this kind of pain syndrome down their arms or into the hands. And the answer isn't just in the wrist. All right, you guys have an awesome day. We'll talk to you next time.